and I'm here to give another live captured lecture and find out if we could break Facebook. And today's lecture is going to be about 2 hours on the pathology of the domestic ferret. After the lecture is completed, we will capture this video and upload it to the CL Davis YouTube channel as well. And for those of you who are concerned about the color problems that we have with live lectures or the keystoning, I will at some point in the future re-record this as a screen capture, which will correct all of those problems. But we like these to be able to capture some lectures live, so when we have really good speakers come in and we only have one opportunity to capture them when they're giving their talk, we do have this possibility. So I know that the video and the audio isn't the greatest, but it's going to get better. So let's start with pathology of the domestic ferret. As I always do, I want to start with thanking all of the colleagues over the years who provided me images that have allowed me to put these presentations together. Certainly want to mention Dr. John Gorham, who is he's now gone, but he worked early in the field of mink and ferret diseases and gave us so much great information, as well as Dr. James Fox, and I do want to single the two of them out. So let's go ahead and start with the domestic ferret. This is a Mustela putorius, furo, Latin for the little thief who catches mice and stinks. And he has a bad reputation, or at least that's a bad name, because I've never actually seen them catch mice. But my father had them as a child. He used to go out hunting and catch rabbits with them, so I'm sure that they would have no trouble catching mice. This is an animal that is widely used both in the pet trade and in laboratories, and we're looking here at the fitch or the sable markings. These are the ones that have the little mask across their eyes. They also come in albino, and over the years, primarily for the pet trade, breeders have mixed the albinos and the fitches to create a tremendous number of different colors. But we're going to look later on at the problems associated with albino animals and albino crossbreds. Domestic ferrets today, in this country, the males generally weigh between 2.5 pounds and 3 pounds, and the females are much smaller, between 1 pound and 1.25 pounds. And this can cause problems because we like these big males and these small females, and this can cause problems with dystocia, as you can imagine. Let's start at the nervous system. The most important disease of ferrets, and I'm probably going to apply that to 3 different diseases over the course of the next 2 hours. But one of the classic diseases, the most important because it is 100% fatal, is canine distemper, caused by a morbillivirus, the exact same morbillivirus that causes diseases in dogs and in a number of other species. And if you know anything about canine distemper in dogs, you know about canine distemper in ferrets. They show the exact same clinical signs, same pathogenesis. However, the pathogenesis and course of disease is often accelerated in ferrets. And one of the problems that we see with outbreaks of canine distemper is that ferrets are sold either in pet stores or by breeders at about 6 weeks of age, sometimes even less. And if they've had any distemper vaccinations, it's only one, and it has not given them complete immunity. One of the issues that we used to see in the past was at pet stores where they would congregate these very young, poorly vaccinated ferrets with a large number of very young, poorly vaccinated puppies. And the chance for the transfer of distemper was rife. We're looking at 2 ferrets with canine distemper. This is an old picture from New Zealand, and you can see that the ferret on the left is down, moribund, has been scouring, and obviously is not long for the world. The one on the right is doing a little better, but you can see the classic signs of photophobia and a nasoocular discharge, which you would expect to see in a dog. And if we look a little closer at these animals, you can see that the hindquarters are matted with diarrhea. Animals with canine distemper are extremely immunosuppressed. So we see a wide range of secondary bacterial infections of both the respiratory tract and the GI tract. And diarrhea is a common terminal finding in these animals. Something else I'll bring your attention to is the hyperkeratosis of the nasal planum. And if we could get a good look at a foot pad, we'll look at some others in a moment, you would see that there is hyperkeratosis, classic hard pad disease in this ferret. Once again, we can see the mucus or suppurative ocular discharge. There's a nasal discharge as well. You can see he's been wiping it on his face. And this orangish discoloration is an early sign of hyperkeratosis. In ferrets, the first sign of hyperkeratosis, whether it's due to distemper or another thing, is sort of an orange discoloration before it gets extremely profound. And we can see that here. Once again, this orange discoloration is actually the buildup of keratin in animals with canine distemper. This isn't a ferret, it's actually a mink with canine distemper. And here you can see exactly how thick the buildup of keratin is on the foot pads of the back feet, so-called hard pad disease. And this animal also suffers from diarrhea. This is a normal lung from a ferret. We can see that the airways are clear, all the alveoli are distinct, they're open. And if we compare it with one from an animal with canine distemper, you can see that in this immunosuppressed, morbilliviral infected ferret, the airways are full of exudate here, here, and here, and you can't really pick out the alveoli except at the very edge of the lung section because they're all filled with exudate. Canine distemper can range from a course of 12 to 45 days in the ferret. Usually it's at the longer end, but there are some ferret adapted strains primarily used experimentally in which death from infection can result in as little as 12 days. It's really not that difficult to make a diagnosis of canine distemper in a ferret. Most of the epithelial cells, we're looking at a cross-section through the urinary bladder, and almost every mucosal epithelial cell has one or more irregularly round eosinophilic 2 to 4 micron intracytoplasmic viral inclusions. And if you look really closely, you may actually find intranuclear inclusions, which is the proliferating virus in paracrystalline array. The inclusions that we see in the cytoplasm generally are viral proteins used for the construction, but don't contain any active virus particles. Being a DNA virus, those are all found in the nucleus. If you look carefully, almost all of the epithelium within this animal's body, whether you look at the airway epithelium, you look at the gastric epithelium, you look at the keratinocytes in the skin, will contain these characteristic cytoplasmic inclusions. Here's a cross-section of one of those paw pads with a very thick proliferation of keratin. This would present as crustiness on the paw pads. You can see the underlying eccrine sweat glands, which help us identify this as paw pad. And you can see, even in the paw pads, there are multiple intracytoplasmic viral inclusions to be seen. So it's not a difficult diagnosis. It often does not require any type of advanced techniques such as immunohistochemistry or PCR. Usually, at least at necropsy, examination of only a small range of tissues will give you the diagnosis of canine distemper. If you do have immunohistochemistry And this image was provided to me by Dr. Matty Kupel from Michigan State. But we are looking at the lung, and you can see that all of this dark reddish purple staining represents actual canine distemper viral antigens. And here's a section through the epithelium lining one of the bronchioles, and you can see the number of cells that are infected by canine distemper in these animals. Many, many cells throughout the body, epithelium and inflammatory cells, will be infected and will contain viral antigen, often displaying the viral inclusions. I want to talk just a minute about rabies in ferrets. We do vaccinate ferrets for rabies, and this is an unfortunate picture simply of a bored ferret trying to get out of a cage. Rabies is very uncommon in ferrets because, at least in the United States, they're primarily indoor pets, and they generally don't have the exposure to wild animals that are required for the transmission of rabies. However, that's not to say that it has not been documented in this species, because it has. I personally have never seen it, but I have seen rabies in mink, which were kept in a facility that also housed ferrets. The mink were kept outdoors, the ferret were kept indoors, and the rabies was traced back to raccoons who would come around the mink enclosure and share food, and that was probably how the rabies was transmitted. The characteristic sign that we see, of course, histologically with rabies are the presence of negri bodies, these viral inclusions within the cytoplasm of neurons. Today, most of our rabies is detected through fluorescent antibody. Looking at histologic sections of the brain in our domestic species is probably not the most efficient. It is much more time consuming, and there are a number of species, including horses, in which about 50% of rabies cases show no neuronal inclusion. So I strongly recommend the traditional gold standard of testing for rabies, which would be fluorescent antibody on the brain of a potentially affected animal. I'm proud to say for the last 20 years, the state of Maryland, where I live, has been vaccinating ferrets for rabies. It is an annual vaccination, but extremely important if you would like to consider having a ferret as a pet. I talked earlier about the problems associated with albino animals and crossbreeding albino animals. This is one that we have known about for about 25 years in ferrets. And we're looking at a litter of ferret kits, and believe it or not, they are all from the exact same litter. The father and the mother were both albinos, and what I want to always get across are basic concepts. And one basic concept that every pathologist should know is that albinism is a birth defect. It is a defect in migration of pigmented cells from the neural crest. It is manifested not only by a white hair coat and possibly lightly colored blue eyes, but there are a lot of other problems that we see in albinistic animals, including deafness, because these pigmented cells go to help form the inner ear. Okay, we can see problems associated with the GI tract, because a lot of the nerves that migrate to their final point in the body, including those of the GI tract, start in the neural tube and they migrate. And albinism is simply one very easily observed sign that defective migration has not occurred. And always remember, birth defects happen in bunches. You rarely have just one. So when you see a birth defect, you want to start looking for other birth defects as well. And this particular litter of ferrets was an excellent example. On one end, the largest animal didn't have a whole lot of things going on, but you notice that it has a cleft lip or cheloschisis, and if we were opening up this animal, you see the palate was cleft as well. This animal also had agenesis of the left kidney. The two smaller kits to the right had these problems. In addition, we can see that the upper jaw is foreshortened in both of them, and their head is fused into what we call a stargazing position because all of the cervical vertebra were fused. And when we turn this one over, you'll see that the top of the cervical vertebra was not even formed. That's cranioracheschisis, a classic neural tube defect, which I will show you in a minute. And you can see that right here. What we're looking at is the ventral cervical body, so the entire top of the spine, the overlying musculature and skin was not formed. The animal was born without most of its brain. The lesion is called cranioracheschisis. Schisis being opening, cranial and rachi meaning the skull and the cervical spine, and anencephaly. And I just want to show you, those weren't even the worst. This was the worst of the bunch. You can see the animal's anencephalic, has cranioschisis, has severe growth retardation, and also has an omphalocele with exenteration of its intestinal tract. Okay, so these are the kind of things that you can see when you mix albinistic animals together. It's a constellation of neural tube defects and is well known with ferret breeders who are breeding either albino or parti-colored ferrets. Just a top view to show you, we're looking down onto the ventral vertebral bodies and the base of the skull. Okay. Other than the endocrine system, most of the problems that we see in ferrets are in the gastrointestinal system. So what I want to do is I want to start at the top. First thing I want to mention is ferret teeth. They tend to crack their teeth off on a fairly regular basis. They investigate their environment with their mouth, and so they're always chewing on something. And you can see that both of these incisors have been broken off, but there's no real bleeding from them. The pulp of the ferret tooth only goes very shallowly into the incisors, and it tends to retract as they age. So they can sustain a fracture of up to 2/3 of the crown of the tooth without requiring any type of root canal or extraction. And you see a lot of ferrets with broken incisors, and usually it causes no problem. You can see this animal has been investigating its environment. It has a large stick of wood that is wedged between its molars. I'm going to show you this picture again later on in the presentation. Periodontal disease and tartar are a significant problem in ferrets, especially older ferrets, because as we'll talk about later on in the GI tract, there's a high incidence of inflammatory bowel disease. And a lot of ferrets of the age of 4, 5, and 6 end up on special diets which are made by their very loving and caring owners. But this type of gruel that they are made, which can contain anything from Ensure to ground up meat, is not good for keeping tartar off of teeth. So bad teeth, bad tartar is a very common problem in ferrets. And as a longtime ferret practitioner, I rarely recommend taking ferrets in solely for the purpose of anesthesia and dental cleaning. As we'll see later on in the presentation, you're going to have ample time to do various surgeries on ferrets as a result of their predilection for adrenal disease, pancreatic disease, splenic disease, and that's a good time to do this dental cleaning. Honestly, I have never seen, I've seen many, many ferrets with bad teeth. I have never seen one that would develop heart disease, specifically vegetative valvular endocarditis, as a result of bad teeth. Well taken care of ferrets, you're going to have plenty of times when you're going to anesthetize them for other conditions, and that's the time to work on their teeth. Here's a cute little Jill, but you can see that one side of her face is bulging out, and it's bulging out because she has developed a mucocele. A mucocele is generally, some people might call this a ranula. Ranulas are typically under the tongue, but a sialocele or a mucocele is a dilated salivary gland or a ruptured salivary gland, respectively, where the saliva ends up in the soft tissues of the chin, the cheeks, or sometimes on top of the head. It generally doesn't cause a tremendous amount of inflammatory response. You can suck out that fluid and you can look at it on the slide, and it's very characteristic for the presence of a mucocele. This is a picture that was sent to me by somebody who owned this ferret, who had a large swelling on top of the head that was fluctuant. You could press on it, and when you aspirated it, you would get this thick, gooey, honey-colored material, which was consistent with saliva that had been sitting in the tissue. And ferrets are interesting in that one of the duct of the zygomatic salivary gland courses over the top of the head by the orbit. And when that ruptures, often due to trauma to the head, you get a mucocele on top of the head. We tend to think of all salivary glands as in and around the mouth and the jaws, but this particular duct goes over the top. Here's another ferret, and the head is sort of dome-shaped because it has a large mucocele you could press, and it was very soft, non-painful. And after treatment, generally all you can do for these, it's very difficult to repair. Usually these are drained, and the drains generally have to stay in for life. And so this particular animal wore a drain for most of the rest of its life, and every time that it would close up, another one had to be put in. And they started disappearing. And I'm going to show you in a little bit where all of these rubber drains were going. But it's a long-term, difficult process to treat. And the hopes of a cure, especially in this location, are very small. We're looking at the thorax of a ferret. The head would be to the right. The liver is here on the left. The lungs have been pushed ventrally by a greatly dilated esophagus. And this is a condition generally seen in younger male ferrets called megaesophagus. And whereas we know a tremendous number of causes for megaesophagus in the dog, which would include myasthenia gravis or lead toxicity or many other possibilities, we just don't know very much about what causes this in ferrets. It does not appear to be related to positioning of the aorta, so we consider it a spontaneous, uncommon disease of male ferrets, but you have all of the problems that we associate with megaesophagus in other species. The animals have great difficulty swallowing. Food tends to just get caught and sit there, and you get severe ulceration, bacterial and fungal infections in these affected animals. And ultimately, like we see in so many affected dogs, they do end up aspirating that food, and this is a case of severe aspiration pneumonia. One of the things that's interesting about ferrets is there are new diseases that continue to be identified. And I want to thank my good colleague, Dr. Mike Garner, for sending me these pictures. This was a condition that was identified about 15 years ago on opposite ends of the country. I was seeing it here in Washington, and Mike was seeing it in Washington State. And this was a condition that has been given the name disseminated idiopathic myositis, and we never actually figured out what was going on here. It was primarily seen in young ferrets who had been recently vaccinated within the last several months, And they would run at extremely high temperature, and there would be marked pain and swelling of skeletal muscles to include the esophagus. And here's the cross-section of the esophagus. You can see the esophagus is not the normal pink, and you have these large areas of white, which represent infiltration of huge numbers of neutrophils. And the interesting part about the neutrophils is that instead of, and the first couple, I'll admit the first couple of cases I saw, I thought that the animal had a foreign body poke through the esophagus and cause an infection, a condition known as phlegmon. But the lumen actually is at the top. We're looking at the submucosal glands of the esophagus, and here are the muscular layers. And the neutrophils actually are present in these layers of skeletal muscle within the esophagus. They are coming from the outside in, which is extremely unusual. We're looking at the hind limbs from an affected ferret. The one on the right is a control. This is what you are looking for. And you could see on the left, the musculature is extremely pale due to not only muscular atrophy, but the infiltration of large numbers of inflammatory cells, which also filled the local lymph nodes. These animals were extremely painful when you touch them and ran a very high fever. Okay, the cause of this condition has never been fully elucidated, and we only very rarely see it today. It was there for a while, and it was gone. And I think the closest that we ever got to this particular disease was a researcher in Europe was creating his own vaccines and trying to do vaccine-related neutering. And in creating these vaccines, at one point he created a vaccine and injected a litter of ferrets, of which they all developed this condition, leading us to believe that this is a very unusual immune-related response to vaccine. Remember, most of the animals we saw had been vaccinated, and you don't think about immune diseases having neutrophils as an effector cell, which was odd in this. But shortly, 3 to 4 to 5 years afterwards, the diseases fairly largely disappeared. And that's because vaccines, especially commercial vaccines, changed their formulation. We believe there might have been something in the vaccine at one point that was widely used and is no longer used, and that's why we don't see this condition. But it was written up, it's been in veterinary pathology, and the name of the condition is disseminated idiopathic myositis, neutrophils attacking skeletal muscle. Never seen anything like that before or since. Okay, I'm going to talk about the most important disease of ferrets. I think I already said distemper was, but let's look at another one. And what I want you to see is this open stomach and the presence of what looks like coffee grounds within the lumen. And this is actually digested blood. This ferret has gastric ulcers, and gastric ulcers are extremely common in ferrets and other mustelids. You will see them in all the mustelids. We saw them a lot in sea otters at the Valdez oil spill many years ago. They all had them. And if you wash off this blood, you generally see, you don't usually see one huge ulcer, but you'll see many small, fine bleeding points, which are scattered primarily through the pyloric area of the stomach. I get a lot of gastric biopsies. I almost never see anything in the antral or the fundic parts of the stomach. When I'm doing ferret autopsies, I usually just throw them away. Everything good that happens in the ferret's stomach happens in the pylorus, whether it's a gastric ulcer or it's Helicobacter. That's where you want to take your biopsy samples. Probably has something to do with the fact that this is where the pH is a little higher. Helicobacter likes that area. They prefer a slightly higher pH as the acid of the stomach meets the bicarbonate of the small intestine. And there's also a place where most of the ulcers develop. If we're going to talk about Helicobacter, let's take a quick look at this organism. They are helical. And it's one of those, it's a bacterium that every ferret has it. Okay, they're generally inoculated by the mother within the first week or two of life, and everybody's got it. About 10% of ferrets over time will actually develop clinical signs associated with Helicobacter. 90% won't, and I can't predict which ones will or which ones won't. And it's a condition that you can give certain types of antibiotics like amoxicillin, clarithromycin, generally in concert with an acid inhibitor, and you can knock down the population of Helicobacter, but you are never going to cure an animal or clear it of Helicobacter. And most of the animals that have shown clinical signs earlier, throughout the rest of their life, will probably have issues with Helicobacter. Now, Helicobacter doesn't kill any ferrets. Okay, it's not that kind of bacteria. It's well host adapted. But it does cause them to have decreased thrift, diminished condition, and be more likely to have problems with other diseases that they will develop. Let's take a look at what Helicobacter does. Here's a cross-section of the stomach in the pyloric area of a ferret that's about 3.5 years old. And if we take a 3.5-year-old animal that is affected with Helicobacter, you can see that it is very different. You have lost tremendous amounts of glandular epithelium. We only have a few glands remaining. And there is a profound lymphoplasmacytic inflammatory response within this section that we don't see in the normal section. Okay, ferrets with Helicobacter tend to be hypochlorhydric, which means that they can't produce the amount of hydrochloric acid they need to digest their food. See, they've lost the mucosa that produces the acid. Okay, so their normal 1.5 to 1.8 pH stomach is now around 3 or 4. And they really have trouble digesting food, especially kibble, which is difficult to digest under any circumstances. These animals tend to have episodes of vomiting. They also have diarrhea. And I was taught in veterinary school that if you have diarrhea, it has to be either small intestinal disease, large intestinal disease that had nothing to do with the stomach. But ferrets didn't read that textbook. So we commonly see loose stools as a result of profound Helicobacter infection. The other thing that this bacterium does is it has the ability to turn the body's immune response against its own tissues. So most of the loss of this mucosa has to do with the body sending lymphocytes against it and wiping it out. Here's another affected animal. You can see the presence of lymphoid follicles in here, some cystic abscessed glands here. And most of this damage is a result of the body's own defenses turned against it due to the presence of Helicobacter and the antigens that it liberates. It is very easy on just about any ferret if you take a silver stain and a section of pylorus to find the bacteria. And you'll find the bacteria deep in the crypts. They are extracellular bacteria. They live very happily in the mucus layer of the stomach, and as such it's very difficult to treat them because it's much easier to treat intracellular bacteria to achieve an MIC for an antibiotic. If it's within cells, it's somewhat counterintuitive. You would think that if you just put antibiotics in, it would just coat the stomach lining, but that's not the way it works. But you can still see these little silver-covered Helicobacteria. And it's amazing what it does because it lives outside the cells, but it causes this profound immune response, which probably contributes to other conditions we'll talk about momentarily. As I said before, Helicobacter is not going to kill any ferrets, but it does contribute to poor condition as ferrets get older. Here we are back to our gastric ulcers, and Helicobacter has never been shown, or Helicobacter mustela, the organism that affects ferrets, has never been shown to actually cause ulcers. Now, there is a causal relationship that has been established in people between peptic ulcers and Helicobacter pylori, the Helicobacter that affects people and other primates. But it's never really been established, and that's a tough thing to do because, you know, if every ferret has it, how do you know which ones caused the ulcers and which one didn't? So we've yet to establish a causal, but certainly it is probably likely interrelated with the amount of gastric ulcers that we see in older ferrets. Ferrets develop gastric ulcers generally as a result of stress, and the most common cause of stress in ferrets is concurrent disease. We see gastric ulcers extremely commonly in older ferrets with insulinoma or adrenal disease. And gastric ulcers are the third most common, the third most important disease of ferrets. And I've given you all three. Okay. Gastric ulcers will kill ferrets, and they can kill them fairly quickly. And generally, I get a number of questions. You know, my ferret is grinding its teeth. Its stools are tarry. I know it has gastric ulcers, but we're going to treat for Helicobacter. And I always say no. If your ferret has clinical signs of gastric ulcers, refusing food, grinding his teeth or bruxism, tarry, malformed stools, you stop everything that you're doing and you concentrate on those gastric ulcers. Sucralfate, small meals fed frequently, you let everything else go. Nothing else your ferret has, whether it has adrenal disease, whether it has an insulinoma, whether it has Helicobacter or anything else, will kill it within 3 or 4 days, but these gastric ulcers can. These are the kind of stools that will be passed by a ferret with an actively bleeding ulcer. This is an urgent situation. They are poorly formed. They're not the normal tubular stools that a ferret will pass. They're black. They're tarry. This is what frank blood looks like. This is what these stools look like. And they have tremendous amounts of digested blood within them. This is an urgent condition. You stop everything else and you focus on treating those gastric ulcers. Now, the vast majority of ferrets, and if you look out here in this part, you'll see your typical gastric ulcers. You'll see these pinpoint bleeding areas. But every once in a while, I'll hear a story that, Doc, my ferret was fine this morning, and I came home and it's dead. It has a little bit of blood around its anus, a little bit of blood coming out of its nose, and what happened? Well, the problem is that the initial part of that statement that my ferret was fine this morning is not true. That particular owner hasn't noticed that the ferret has not been eating, has been grinding his teeth, and has been showing the signs of the classic pinpoint pyloric peptic ulcers. In a small percentage of cases, however, because the blood vessels that course through the pyloric stomach tend to go pretty close to the surface, one of these bleeding points can erode down into a blood vessel, and then you have a major bleeder into the stomach. There's no way you're going to get into it, and then it's probably going to bleed out in about 5 minutes, and that's what happens here. I treat gastric ulcers extremely seriously. Okay, this is what we are trying to avoid right here. This is what we usually start with, and if we are diligent with care and feeding and removing stress and stopping other medicines at the time, the chances of getting a very good healing, for these little bleeding points is good. Once it gets to this point, we're not going to have any luck. Here is a large lymph node on the outside stomach, and you can see it's red because it has absorbed a lot of hemorrhage as well. Another great picture from Dr. Kathy Fent at Lincoln Memorial Hospital. You can see here's the pyloric stomach. Here are all those little pinpoint bleeding points. We can help this ferret. Then here's the big one at the pylorus, which is eroded down, and there's nothing we can do for this one. Back in the early 90s, I was either lucky or unlucky enough to be pretty much at 0.0 for a disease of ferrets, which was, and occasionally you'll still hear the name, the green slime disease. In ferrets, most new diseases are initially called mystery disease or X disease. This one, because affected ferrets would produce this fluorescent green, slimy, mucus-laden feces. This went by the name of green slime disease. And it turns out that this was the first form of coronavirus infection in ferrets. We had known about coronavirus in mink, where it primarily affects the stomach, and it's called transmissible mink gastroenteritis. And the typical story is that somebody would get a new ferret from either from another breeder or from one of the major producers, and would bring this young, very healthy, active ferret in, and within 2 days, all of the other ferrets in this facility were blowing this greenish, mucusy slime. And eventually, they would get better, and it didn't kill a whole lot of people. It did cause problems for the very old ones who would get dehydrated, and they've had other problems, but it was a very high morbidity, low mortality condition. And that started about 10 miles from where I worked. And what we would see with these animals is that they usually went on pretty well, but they would lose fat quickly, and they would have this sort of Kelly green, loose stools throughout their entire GI tract. It wasn't a very difficult diagnosis to make. We just didn't know initially what was causing it. This is a nice picture from some experimental studies done by Dr. Matty Kupel. This is the normal intestine of a ferret with normal intestinal contents. This is an animal that was affected with, and actually in the reparative phases of coronaviral enteritis, you could see that the intestine is extremely congested, and the feces has sort of a birdseed appearance, because during the reparative phase, it would still have trouble digesting fat and protein. It would be passing these rather large clumps of fat and protein through, and we would call those birdseed stools. And initially, we thought that they were specific for this disease. We've realized over the years that any chronic disease that results in malabsorption and maldigestion due to reducing the surface area in the gut will give you, at least in this species, feces that look like birdseed. This is a normal jejunum from a young ferret, and you can see that the villi are long and plush. And this is what you see in an animal that was infected by coronavirus. And coronavirus is a virus that has a particular tropism for the epithelium that lines the villar tips. And it affects these particular cells, and it causes them to die. And what happens is, when it does, the villi shrink down, because all they want out of life is to be covered by epithelium. And they will contract to the point where they can be re-epithelialized. And a lot of times, they will actually fall together. And then the body will put a new layer of epithelium across the top. And you've lost about 90% of your surface area. You can see the sides, which are now glommed together. And instead of having 5 or 6 healthy villi, we have one short, clubby, malformed villus. And there is a pretty profound inflammatory response going on as well. In the very acute phases, this is what the epithelium of the tips of the villi look like that's been infected by this coronavirus. It's vacuolated, it's necrotic, it is beginning to slough. Dr. Matty Kupel developed an immunohistochemical test, and it very nicely demonstrates the presence of the coronavirus antigen within the cells lining the villus. This particular virus, like most coronaviruses, does not like the crypt or the regenerating epithelium, so it's not usually a life-threatening problem. These villi will regenerate. It may take a while, but this is the nature of coronavirus. We're going to talk a little bit more about coronavirus later in the presentation, because we're not quite done with ferret enteric coronavirus. Here's some transmission EM, which show the presence of coronaviral particles within vacuoles in the enterocyte cytoplasm. Whether these represent smooth endoplasmic reticulum, most likely sometimes it could be a lysosome, but they probably are reproducing in the smooth endoplasmic reticulum of the apical cytoplasm of these enterocytes. And if you catch these animals very soon after they break, within the first 3 days, you can take fecal material, you can put it under the scanning scope, and you can actually see the presence of these somewhat pleomorphic viral particles, which have a ring of peplomers, which give the coronavirus, corona meaning crown, its name. About 20 years ago, we started seeing inflammatory disease in the intestine of ferrets without a pre-existing cause. And today, inflammatory bowel disease is one of the most common diseases which affect ferrets. And because of the increase in technology and because people have endoscopes now, we see a lot more cases through endoscopic biopsy. It's an extremely common problem that we probably don't have a good handle on. And inflammatory bowel disease across all animal species, including people, is something that we just don't have a good handle on the causes. It's usually a multiple number of causes. Often it could be due to dietary antigens, bacteria, parasites, and how this interplay. And you might not know, but your intestine contains over half of all of the immune tissue you have in your body, and that includes lymph nodes and lungs and everything else, because the GI tract is actually the outside. The lumen of the GI tract is the environment. And so the body puts a tremendous amount of immune cells in there to monitor what's going on. And when something stimulates that, causes it to go haywire, causes tremendous numbers of issues. So inflammatory bowel disease is something that continues to grow in popularity in ferrets and other species. One of the classic signs of inflammatory bowel disease is this beautiful birdseed stool, which we said before is not specific to enteric coronavirus. We rarely see cases of enteric coronavirus today. That's more of a historical disease. It's passed through the ferret population in the U.S. and most other countries. We just don't see much of it anymore, but we continue to see inflammatory bowel disease. Years ago, I took a look at my cases of inflammatory bowel disease and found that approximately 40% of them still had coronaviral antigen in the gut. So I think that that's one of the possible factors in play. We also know that most of these animals that have IBD also have Helicobacter, which stimulates the immune system of the gut. Okay, today we feed the ferrets, which are obligate carnivores. Normally in the wild they live on small rodents. We feed them a mixture of plant and chicken and many other types of protein that they normally don't eat. So dietary factors. So all three of these, and there's probably more I'm not even thinking about, go to the large amount of inflammatory bowel disease that we see today. And when I look at inflammatory bowel disease, and there's a tremendous number of, especially for the cat, there's a fair number of different protocols that you can follow histologically to determine whether you have inflammatory bowel disease or not. I like to keep it very simple. To me, I look for two things before I make the diagnosis of inflammatory bowel disease. One is loss and shortening and blunting of villi. If the villi are nice, long, and plush, you don't have inflammatory bowel disease. And then we are going to go up to 40x, and I don't like 40x a lot, but what I am looking for is the presence of intraepithelial lymphocytes coursing between the mucosal epithelium. Here's a lamina propria, here's a lacteal. I don't care what's in here. I really don't. Okay, it's the ones that go up into the mucosa that I like, and I once upon a time I had a very nice scoring system based on how many lymphocytes were in and how many lymphocytes were touching every epithelial cell. It got a little complicated, but This is way too many lymphocytes within the mucosa. That is what we expect to see in inflammatory bowel disease. And a lot of these animals will respond to a low daily dose of steroids given orally. And I know when I say steroids, a lot of the younger pathologists and practitioners are going to gasp out there, but steroids are great in ferrets. Ferrets have a wide range of immune-mediated diseases. We'll talk about it in the skin, and we'll talk about it in the GI tract. There's quite a number. And they're also a very steroid-resistant species. So I would rather give a little bit of steroids to a ferret than have it be miserable. There is another form of inflammatory bowel disease that actually predates the one I talked about, which is primarily lymphocytic. And it was first identified back in the mid-90s by Dr. Jim Fox and his group up at MIT. And they called it eosinophilic gastroenteritis, which isn't a bad name, and it's very descriptive because the effector cell of this particular condition, and the one that you will see in the intestine, is the eosinophil. And eosinophils are much more damaging than lymphocytes, and they have a wide range of very devastating enzymes that they will release, including major basic protein. And when you get a lot of them together, they will release the protein, and they'll form these beautiful Splendora Hopley arrangements. We're looking at a mesenteric lymph node. The only thing that's changed since Dr. Fox has identified this is that we have identified this not just in the GI tract, but you can see it in any organ in the abdominal cavity. You can see it in the lungs. So it's much more than an eosinophilic gastroenteritis. It's an eosinophilic autoimmune disease, which is systemic in nature. I can tell you that I have diagnosed it by a lot of other biopsies sent for other reasons. Someone sends an insulinoma, and you can see that the blood vessels are full of eosinophils, and it's like, does this ferret have a peripheral eosinophil? I think it also has eosinophilic immune-mediated disease. So remember that one, eosinophilic gastroenteritis or eosinophilic immune-mediated disease. Another condition identified back in the day by Dr. Fox and his group at MIT, and one that affects young male ferrets is Lawsonia intracellulare infection, also known as proliferative colitis. And when we look at the colon, you should be able to read a newspaper through it. And this one is thick, it is corrugated, and this poor animal is very painful. Its abdomen does not like you touch its abdomen, and it frequently defecates about every 15 minutes, and it looks like this. It's poorly formed, it has frank blood in it, and the animal will vocalize when it's defecating. So it's a very painful process. And if we open up the colon, there's a nice picture by John King of a colon in a ferret, and you can see this is normal here. This is very hemorrhagic, and the mucosa proliferates and is thrown into these glandular-like folds. There's a lot of blood associated with that, and they're very fine bleeding points, and it's very difficult to ever find them, but it just sort of seeps blood that goes out in. Now, Lawsonia intracellulare is by no means unique to ferrets, is by no means a unique organism, but ferrets are unique in their infection in that they are the only species in which it affects the colon. When we see it in hamsters, when we see it in horses and rabbits and all the other species that get Lawsonia, generally tends to affect the ileum. But in ferrets, it affects the colon. So remember that, proliferative colitis due to Lawsonia intracellulare. And histologically, when we look at a section of this, you'll see fairly normal colon. There's a bit more inflammation than I would like to see here. But then in these segments which grossly represent these glandular proliferations, you can see a random proliferation of immature colonic epithelium. It does not contain the mucus that we normally see, and this just continues to proliferate. Surrounding this are an infiltrate of macrophages, and some neutrophils because there is often ulceration of the overlying epithelium. And histologically, if you put a silver stain on these, within all of these proliferating immature colonic epithelial cells, you will see these large apically placed bacteria. And this is Lawsonia. Unlike Helicobacter, which is extracellular, Lawsonia is intracellular, making it easier to treat. Okay? The best drug against Lawsonia in ferrets, and one that's tough to get a hold of, is chloramphenicol. Because chloramphenicol is not used in any food animals, we try and keep it out of our pharmacies because it does cause aplastic anemia in people. It's been banned in any type of food animal. Occasionally it's used by exotic practitioners in bird diseases, and if you don't have any, contact one of your local bird practitioners. They may be able to get you some, but it works like a wonder, on these bacteria. Not a great picture, but we'll talk for just a minute about Giardia. I think Giardia gets a bad rep. See a lot of Giardia in the gut, never really causes any problem. We tend to blame Giardia if there's diarrhea we can't get a hold of, and then all of a sudden, oh, it's Giardia, the ferret's been drinking out of the fish tank or whatever, it's got Giardia, and Giardia really doesn't cause much of a problem, but you will see it if you're a pathologist. But I generally pay it absolutely no mind. Here's another very nice picture of Giardia here. If you looked at this particular section of this jejunum with foreshortened villi, with an area of fibrosis, loss of crypts, and this inflammatory response at low mag, and you said, I think this animal has coronavirus, I'm not going to disagree with you. It very well does. And the other disease that looks very much like coronavirus, not just histologically, not just to the pathologist, but to the person out there who is cleaning up greenish diarrhea, is coccidiosis. If we look at this villus closely, you will see that almost every single enterocyte contains a coccidian meront. Ferrets get two types of coccidia, actually three. They get two species of Eimeria, one species of Isospora. Here is a microgamete. And coccidia usually don't cause real problems in ferrets unless it's an overwhelming infection in a very young animal or a very old animal. And then you may see some significant morbidity. What it usually does is cause greenish diarrhea. And coccidia is still with us. It's not uncommon. And whenever I get a phone call saying, I think we have a new variety of coronavirus, it's almost exclusively coccidia. And what generally happens, it's a large facility and very well-meaning volunteers are in there taking care of all of these animals. And God bless all the ferret owners of the world. They are the salt of the earth. I love them all dearly. But they start at one end of a bank of cages, and they take all the ferrets out, and they put them on the floor, and the ferrets have a great time. And they take their cloth rag and their soap and their bucket of water, and they clean up the cage. And then they put in all the bedding, and they put the ferrets back. And then they go to the next cage, take all the ferrets out, take out and clean all the bedding, and they take their bucket and their wash rag and their soap, and they clean the cage. The problem is they don't dump the bucket in between cages. So if you have one ferret with coccidia in the first cage, by the end of the week, they'll all have coccidia. So, coccidia is probably the most common cause, provable cause right now of diarrhea in large outbreaks. So remember coccidia: Eimeria furonis, Eimeria ictaluri, and Isospora laidlawi. Occasionally, if you're very interested, I think years ago we documented that the coccidia will occasionally go up the bile ducts, and you can find them in the bile ducts, the gallbladder, and even in the liver. And that's sort of cool. Hey, here's a great picture from Dr. Matty Kupel reminds me, these are very young kits, less than 2 weeks of age. And diarrhea in young kids, you want to think about rotavirus. There are many kinds of rotavirus A, B, and C, and sometimes you'll get them all in the same kit. And when you buy these kits from the large breeders, they probably come with it. And they don't cause any problem, except in kits less than 2 weeks of age, probably even significantly less. And the kits here have intestines which are full of undigested milk, because rotavirus affects the cells on the villi tips, just like coronavirus, and reduces surface area, and they get a severe osmotic diarrhea. It's rotavirus. Okay, this is actually one of my ferrets, and I want to talk for a minute about foreign bodies. We already mentioned that ferrets will investigate their environments with their mouth, and they get into everything. And this particular ferret, whose name was Oscar, loved plastic bags, and he went to surgery 4 times to remove plastic bags. And soft foreign bodies are the worst because they're very difficult to identify. They don't show up on radiographs. And I've always believed that if you are thinking, if you have an animal that has a history of chewing on things, or there's any reason you think that a ferret has eaten something, they make great surgical candidates. Go in there often. Don't let the sun go down on a potential foreign body in a ferret, and they are very common. This one loved the rubber stoppers on the door jamb, and he loved plastic bags. And this is not him. This is another one. I guess the rubber stoppers are universal. Obviously, this didn't end up very well for this ferret. And this is the little wiggly door stopper that's at the base, and it's right at the ferret's level. It makes a funny noise, and they love rubber. Absolutely love to get into rubber. So rubber toys are not what you want to be giving to your ferret, because they're going to chew it up and swallow it. Do you remember the ferret with the zygomatic mucocele I told you? And I said that those drains kept disappearing. This was not from that ferret. This was from that ferret's running mate, which was in the same cage. And that ferret loved latex too, and kept pulling those drains out and eating them. So you had one ferret with a mucocele, the other one with a stomach full of latex drains. Rubber bands. They love rubber bands. Anything rubber. Got to be very careful. That's part of ferret proofing your house. Make sure there's no boards missing in the floorboards that they were going to get into them. And you got to take out anything that's rubber, cloth, or whatever. Now, this ferret did not swallow a quarter. That's not what's going on here. But I want you to see these 3 hairballs. Notice how they are in the exact shape and size of a ferret's stomach. I don't know how ferrets and rabbits do it, but they can pretty much fill their entire stomach with hair before you notice the first clinical sign. And of course, for both of these species, this is a surgical problem. You can't feed them, digestive enzymes or papaya or pineapple juice. It just doesn't work. These are surgical candidates, and ferrets make great surgical patients. So if there's any question, just go right in. Usually you can demonstrate the presence of these with barium, and then you just pop them out. More foreign bodies. Remember this ferret from early in the lecture that had the broken teeth and had that wooden piece? When we took that out from between the molars, it had a large oronasal fistula, which required. It was a hole here between the mouth and the nasal cavity, which was pretty much the same shape because this piece of wood had been putting pressure on it, caused resorption of the bone, and that had to be repaired. This is a great case from Avery Bennett down in the University of Florida, and this was a ferret that was investigating its environment with its mouth, and it chomped down on an electrical cord and burned a large oral nasal fistula in the top of its mouth. If you look carefully, it also traumatically amputated and cauterized its tongue at the same time. Dr. Bennett was able to fix this with a couple of flaps, and the animal did quite well after that. But got to watch ferrets when they investigate. We're looking at granulomas in the liver of a ferret due to Mycobacterium bovis. Ferrets are obligatory pets or laboratory animal creatures, with the exception of those in New Zealand, which have established feral colonies and live in the wild. And one of the issues that they do get into, like badgers in the UK, is they are prone to developing Mycobacterium bovis. And of course, this is going to be of great concern to cattle producers, producers of small ruminants in the area, and it has given feral ferrets a very bad reputation with the local livestock producers. This is an old picture of a Siberian polecat from the National Zoo in the 1980s. Case was published by Dr. Yvonne Schulman, and you can see the stomach is extremely large, and it is sort of covering up everything else. And this is a case of Clostridium perfringens type A. And it turns out that the animals were eating infected horse meat that were carrying this particular bacterium. But occasionally you'll see Clostridial perfringens infections, especially in animals that have poor motility of the gut. Nice histologic section showing the necrosis of the superficial lining of the stomach, and you can see all of the Clostridium which are adherent to the necrotic tissue. They usually don't hang on to the intact tissue, but you'll find that as time goes by, you'll see more and more necrotic tissue in these cases and less viable tissue. No, we are not squeezing this ferret kit too hard and making his rectum pop out. This is rectal prolapse, and you can see this as a result of a number of issues in young ferret kits. Most commonly is a rapid change in food from what it has been eating at the pet store and the producer or the breeders, and then the owner takes it home, feeds something totally different. The animal gets diarrhea. And, rectal prolapse in the ferret is essentially the result of having nothing solid to push against. And that when the fecal content is fluid, that rectum continues to contract, and eventually will prolapse. You can also see this with coccidiosis. Not a difficult problem to replace. Put on some emollients. Every once in a while you need to purse string the animal, but usually it's not a serious issue. If we look at tumors of the GI tract, we're looking at the mandible of this ferret. You can see that we are missing several teeth, and we have a large proliferative lesion, which not only is replacing the gingiva, but also appears to be causing a large swelling of the mandible. And when we talk about tumors of the jaws in ferrets, we're talking about squamous cell carcinoma. These are generally non-treatable. Usually they are advanced when the animals are presented. They do not apparently respond significantly to chemo or radiation. And probably this is going to be a mercy euthanasia when the animal has a pathologic fracture of the mandible. The number 1 tumor of the intestinal tract, number 3 overall, and the most common malignancy in ferrets is lymphoma. We'll talk about that in a little bit, but this is intestinal lymphoma. Intestinal lymphoma because the inflammatory cells will replace the entire wall, including the mucosal lining, so whatever's going through the GI tract basically goes right into the bloodstream, carries with it probably the shortest survival time of any form of lymphoma. and we see it commonly in the GI tract. How many of these arise from pre-existing cases of inflammatory bowel disease? I can't tell you, but it's probably a pretty common sequela to long-standing IBD. Truth in advertising, this is actually a skunk, but they're pretty darn close to ferrets. And we're looking at the GI tract, and we have a very empty distal intestine going to the colon, going to the anus. We have a very dilated food-filled proximal intestine, and right here at the junction, we see this sort of whitish, contracted napkin ring appearing neoplasm. This is an intestinal adenocarcinoma. They tend to carry a somewhat better prognosis than lymphoma because they tend to be fairly isolated if you get them quickly. The problem with this particular case is because of the dilation of the proximal gut, which is food filled, you're not going to be able to sew those two ends together. So this animal didn't have much of a chance. But these are intestinal adenocarcinomas, and we'll see them occasionally in mustelids. Another neoplasm I've seen 4 or 5 times over the years is squamous cell carcinoma of the anus or the anal sacs. And this is a histologic presentation of one of these squamous cell carcinomas. We have a huge mass here arising from the epithelium of the anal sac. This has been documented in mink by Dr. Bill Hadlow back in the 80s as well, when he was working with mink. So it's coming right off of the lining of that anal sac. Very pleomorphic, ugly-looking tumor. Okay, let's move on to the liver. Hepatobiliary and pancreatic systems. How about we just talk about liver and pancreas? Diffuse hepatic lipidosis is extremely common in ferrets, and it's not actually even a disease. Ferrets are obligate carnivores, and they have to eat 4 to 6 times a day, small meals, fed frequently. Okay, if they don't do that, if they go, 12 hours, 24 hours without eating a meal, their body is going to mobilize immense amount of fat, which will go to the liver. They'll flood the liver with fat. This will eventually be complex with proteins resecreted as triglycerides into the bloodstream. But what you get is either this diffuse yellow fatty liver, or sometimes in some animals, you'll get just yellow nodules throughout the liver. And it's always of interest to practitioners when they're in there to do pancreas and they see this big yellow liver or these dots through the liver, and they think, oh my gosh, I've got metastatic neoplasia. And over the years, I've looked at so many livers, and it really means nothing. It's a physiologic finding, and it's also reflective in the clinical pathology findings you'll see on this animal. And if the SGPT or the ALT, whichever you like to call it, is less than 1,000 in a ferret, even though your lab is going to tell you 125, anything over 125 is too high. If it's less than 1,000, I don't worry about it, because this is what they do. And it's a leakage enzyme, and these hepatocytes get big and fat, and it stretches the membrane, they release ALT into the bloodstream and all that. But then if you fix the pre-existing condition, why this animal's not eating, when you come back in 2-3 weeks, it's going to be totally normal again. So I don't get excited about high ALTs in ferrets because of the high incidence of fatty livers. So remember, physiologic, not pathologic like we see it in sheep and ponies and cats. It's just an everyday thing in ferrets. Aging changes. Okay, ooh, look, see these little white dots? Little white dots in the liver? Has nothing to do, it's not cancer, it's not anything. It's those little nodules of fat because the animal is undergoing a mild case of agroceriosis, and it's probably sending a little more fat. And some animals, they just manifest in these little dots. Some of it, really do the whole liver. Okay, just like a cat, we see multiple nodules within the pancreas. They're white. They're essentially the same color as the surrounding pancreas. They're raised. This is an aging change. These are nodules of exocrine pancreatic hyperplasia. don't mean anything. Liver tumors. Number one, most common liver tumor is going to be lymphoma. This is not lymphoma. Lymphoma would be raised white nodules or even a diffusely enlarged liver. This one is these are cavitated. Okay, they're raised, they're lumpy, bumpy. I'd flip a coin to tell you whether this was biliary carcinoma or hepatocellular carcinoma. This one turned out to be a hepatocellular carcinoma. Usually when I see cavitated nodules, I think about biliary carcinomas. This one just turned out, and hepatocellular carcinoma are much more common in ferrets than biliary carcinomas. And I'm going to actually amend that in just a moment. This is a very common finding in ferrets, and initially, I thought that these were either biliary adenomas or ductal plate malformations, so-called von Meyenberg's complexes. And it's not a big deal. But a friend of mine named Charlie Weiss, who's still in practice in Potomac, Maryland, noticed over time that these things would start out very small at the edge of the liver, and if he followed them ultrasonically, they would turn into these rather large neoplasms, which were cystic and would essentially take over an entire lobe and eventually move on to other lobes. Histologically, they look very much like biliary cystadenomas, very flat, cuboidal epithelium lining these large cysts, low mitotic rate, but they behaved like cystadenocarcinoma. So I just usually call these cystadenocarcinomas these days, even though if you're not familiar with their behavior, you are going to argue with me. But just remember, in the liver, nothing is what it seems. Okay, we talked about the GI tract, which was number 2 in terms of overall presentations of ferrets to practitioners. Number 1 is going to be the endocrine system. It's only 2 diseases, but they compose the vast majority of the reason that ferrets eventually go to the vet. If you take a look at this ferret, some of you may have the exact same expression on your face right about now. This is a ferret who is hypoglycemic and has lost touch with its surroundings. It's also known as a petit mal seizure. It's not going to be jerking around or anything like that, but it just sort of zones out. Here's another one that's sort of zoned out, drooling a little bit, which is sort of characteristic, and they go through these periodic bouts of hypoglycemia. These are clinical signs that are associated with insulinoma in the ferret, or islet cell tumors. If you want to call them insulinoma, that is fine. They almost exclusively secrete insulin. I'm still looking for that glucagonoma, but I don't think I've ever found one. And in the ferret, as opposed to dogs and cats, in which islet cell tumors are extremely aggressive, islet cell tumors in the ferret tend to pursue a benign course. That's not to say that they don't secrete insulin, resulting in hypoglycemia and all the associated problems associated with that. But unlike cats and dogs, where they metastasize early and widely to the liver, the lymph nodes, and other viscera, in the ferret, they tend to stay put. And you can have 1 or 2, but they don't metastasize. 25 years, I've seen 2 malignant islet cell tumors, which I documented by metastasis. The histologic features of malignancy really don't apply to insulinomas or most other endocrine tumors. They tend to be very bland, very monomorphic with the occasional pleomorphic cell, but they don't show a lot of histologic features. So you're pretty much relegated to, did this one metastasize? Now, if we take a look at this particular nodule in the pancreas, first thing I want you to see is that it is solitary, not like the exocrine pancreatic hyperplasia, which was a bunch of little nodules. And if you look closely here, we may see some of that going on here, little raised white nodules. It is not the same colors the surrounding tissue, it is red because it's heavily vascular. And endocrine tumors recapitulate endocrine tissues, and endocrine tissues are heavily invested with blood vessels because they secrete hormones that have to get out into the bloodstream and go all over the body. So endocrine tumors themselves are going to have a lot of blood vessels, and that is going to make these tumors a very jarring red in color. When we talk about the ferret pancreas, the ferret, as we've mentioned, is an obligate carnivore, and it eats almost exclusively protein in the wild, and it has to eat fairly frequently. So it moves that stuff through the gut very quickly, and believe it or not, the actual GI transit time for a ferret on its natural diet is about 4.5 hours, mouth to anus. It's amazing. And to do that and to break down that protein so quickly, it needs a lot of pancreas. And the ferret has more pancreas pound for pound than any other species. It has the traditional jejunal arm, and it also has this gastric arm. It has 2 arms to its pancreas, which allows it to digest quickly, but also gives it twice as much surface area to develop insulinomas, which are a very common problem in ferrets, actually, which are the #1 neoplasm in ferrets. Many are active and secrete insulin. Some don't. So when you're necropsying 8 or 9-year-old ferrets, look carefully. I can almost guarantee you're going to find one. It probably wasn't active, but they do develop these a lot. We don't know why. It's probably because we've modified their diet and we put them on plant protein and chicken protein and all sorts of other things that they normally don't get into the wild to make them what we call good pets. But remember, huge amount of pancreas, which has allowed practitioners to treat these pancreatic tumors by partial pancreatectomy, removing this perigastric arm. Now, the jejunal arm has the pancreatic duct, and the common bile duct may go through that, so we never touch that. That's bad stuff. If there's any insulinomas in the jejunal arm, we just sort of pop them out by themselves. But you can take half of the ferret's pancreas away, and that will help the situation. Now, studies in the 90s showed that nodulectomy of pancreatic insulinomas resulted in regrowth of additional tumors about 60% of the time within 10 months. And that's because they're probably dietary related. We did not really do anything except pop them out. So if you have a ferret that's developed an insulinoma and you take one out, chances are you'll be back in the next year to get another one. The good thing is that gives you 2 times where you can go in and clean its teeth as well. This is a pretty good looking insulinoma. It looks just like a huge islet, but you'll still see that there are other islets here. You don't see the islet atrophy in ferrets that you see in other species with insulinoma. This is an insulinoma. Here's one that looks totally different. It's well encapsulated. Okay, still an insulinoma or an islet cell tumor. Remember, I'm not going to look for evidence of malignancy in here. If you're going to look for it, you can always probably find it if you look hard enough, but they're not going to go anywhere. I consider them neoplasms that pursue a benign course. The most common presentation of ferrets to practitioners is the result of adrenal-associated endocrinopathies. An adrenal disease in ferrets, and I'm going to say it, I'll say it once, I say it a lot, a ferret is not a cat, is not a dog. And although we have bilateral truncal alopecia and hair loss here, this is not Cushing's disease. This is a totally separate disease that's primarily seen in ferrets and rarely in mice and in people. Ferrets, the vast majority with adrenal disease, proliferative lesions of the adrenal gland, whether they're cortical hyperplasia or neoplasia, do not produce excessive levels of cortisol. You can rarely see it, but usually doesn't happen. what they do is they produce excessive levels of sex steroids. That would be testosterone, 17-hydroxy-beta-progesterone, and estrogen. What we're looking at in this animal is the profound effect of estrogen on the hair follicle, resulting in follicular atrophy and hair loss, usually starting on the tail, sometimes restricted to the tail, but the next season progressing forward over the body. Bilateral truncal alopecia. One thing I've learned about adrenal disease, it's nice to say it's bilateral truncal alopecia, but you see all sorts of odd different combinations. My friend Charlie Weiss first brought to my attention, if a ferret's losing hair on its toes, it's probably adrenal disease. He was right. If a ferret's losing hair on top of its head, I've seen them just lose on top of heads, it's adrenal disease. Okay, so don't say it's not the typical pattern of hair loss. If it's hair loss, I'm thinking adrenal disease first, second, and third place. And this is what happens when it has been going on for quite a while and we have almost total hair loss. I firmly believe that there is a market for nude ferrets. Unfortunately, it takes so long to develop one of these. These animals are usually, 5 to 6 years of age. They're in what we call the golden tumor or the golden period for tumors. 5 to 7 years of age, they don't develop adrenal disease, insulinoma, whatever. But this is a cute little animal. So how does this adrenal-associated endocrinopathy occur? Well, it starts largely with early neutering. Now, we do occasionally see adrenal disease in intact animals, but nowhere close to the proportion that we see in early neutering. So we go in at 4 weeks of age and we remove the gonads, the testes and the ovaries from this animal. And these are seasonal breeders. So every season, the hypothalamus, as the days get longer, the pineal gland realizes that the days are getting longer, sends a message to the hypothalamus saying, hey, it's time to come back in season. Let's get everything into good shape. So the hypothalamus messages the pituitary through the release of gonadotropin-releasing hormone, and the pituitary releases two hormones which act on the gonads: luteinizing hormone, or LH, and follicle-stimulating hormone. And just to make it easy for you, you can forget follicle-stimulating hormone. We're not going to talk about it anymore. It's the luteinizing hormone that turns everything on. And so the pituitary continues to send luteinizing hormone out, waiting for those gonads to respond, which have been removed surgically. And so they never respond. And it just puts out more LH and more LH and more LH. And finally, the adrenal cortex says, okay, the heck with it. I will go ahead and produce the sex steroids that the gonads are supposed to produce. And they just get tired, and they start to abnormally, in the zona fasciculata and the zona reticularis, to produce a range of sex hormones that they normally don't produce, including progesterone, estrogen, and testosterone. Here's a quick pop quiz. Can you identify the ferret with adrenal disease? And so the liberation of these sex hormones are going to cause changes in ferrets that you normally see only in animals who are intact, cycling, and in a reproductive phase. In this young Jill, one of the obvious signs is the marked swelling of the vulva, because the fibroblasts within the vulva soft tissue are very responsive to estrogen, and they will swell up to 400 times normal size. Of course, we've talked about the alopecia that you'll see because of the effect of estrogen on the hair follicles. The animals will go back into reproductive behavior. They will start to mount, even though they've been neutered, they will start to mount other animals. They will begin to bite. They may fight. So it's like getting an intact animal back. Early on, the literature said that for some reason, 90% of the adrenal tumors were on the left adrenal gland. And we're looking down into a ferret, like we're on a surgical table. This is the left side, and the left adrenal gland is sitting here right on top of the left kidney. Fairly easy to get out, fairly easy to pop out. Okay? The right adrenal gland sits here on top of the right kidney, the anterior aspect. But more importantly, it sits under the caudate lobe of the liver. I've actually flipped the caudate lobe of the liver up, and it circles around the largest vein in the body, the posterior vena cava. So it's no surprise as to how in the early days people would say, oh, I'm going to take out the left one because I can get to that. And I'm really pretty frightened about trying to scrape this right adrenal gland off of the posterior vena cava while working under the liver. Nowadays, there have been a number of other approaches to this, including microvascular surgery, cryosurgery, and all that. And now that people are taking off the right adrenal glands in a much easier and much more confident fashion, we realize that, there is no difference. It's 50-50, right or left. And a large number of animals will have them eventually on both sides. You may go in for one and eventually have to go in for the other. And that's interesting because I was taught in vet school that if you don't have any adrenal glands, you're going to die. But it turns out that ferrets have a tremendous amount of adrenal cortical tissue scattered through the abdomen in ectopic locations, which may help with that. And this may actually be a little piece right here. And they also respond very well to mineralocorticoid injections once a month. So taking out both affected adrenal glands with hyperplastic or neoplastic lesion is not the kiss of death for ferrets. I try to keep, sometimes these things can get absolutely huge, but I try to keep the diagnosis very simple. This is the only normal adrenal gland you'll ever see, guaranteed. Now, if there is one large nodule, it's an adenoma. And usually you will not see changes in the contralateral cortex. It's going to be normal. One large nodule, I'm calling it an adenoma. Multiple nodules, I'll call it nodular hyperplasia. And then when I cannot tell the difference between cortex, medulla, and tumor, I'm going to call that a carcinoma. Now, the prognosis for all three of these is just about the same. Probably way less than 10% of these ever metastasize if they're carcinomas. There is one form that tends to, the myxomatous form, that tends to metastasize. The rest of them, they're very well-behaved carcinomas. They will secrete sex steroids, but they rarely metastasize. So this is something that even if you get a carcinoma, it's important to let the owner know that even though it's a malignancy, they tend to pursue a benign course until very late in the course of disease. So it's a good chance that A, you're not going to see any long-term signs of this particular carcinoma, and B, you may have to go back in and get the other adrenal gland as it goes bad over time, because that ferret is going to continue to secrete LH. You can't take out his pituitary gland, I can tell you that. Hey, here's a great picture from Unita Bryan on something else that you might see in the adrenal gland of a ferret. And you see this a lot, and it's always on the right side. You see this waxy material? Well, due to developmental errors, a lot of ferrets have, in their right adrenal, will have biliary cysts. And the two often form an accreta without a capsule between the adrenal gland and the liver. And sometimes you'll get these biliary cysts, and they will be secretory, and then they will be middle-aged. The animal will come in for something, and you'll notice this sort of waxy material. You can pop it out if you want. And these are biliary cysts. They're often associated with hyperplastic changes of the right adrenal. But what a great picture this is. Here's another one that came into the AFIP a number of years ago, and the animal came in and was radiographed for an unrelated thing and found that bilaterally in the area of the adrenal glands, there was mineralization. And the animal didn't show any signs of adrenal disease. It didn't have any, had no hair loss or anything. But they went in and explored it and took out both adrenals. And what this is, ferrets are odd creatures, and they do everything with their adrenals. And this particular ferret had formed bilateral teratomas. And this structure right here is actually a tooth embedded in alveolar bone. There's fat, there's skin, there's GI tract, all within the adrenal gland on both sides. Moving on from the adrenal, one more endocrine disease that you probably will never see as part of a biopsy, but we do need to mention because it is becoming more and more common as ferrets get more and more prednisone or steroids, and that's diabetes. Type 2 diabetes, islet exhaustion. A lot of animals who are not surgical candidates for insulinoma will be given cortisone to raise the blood sugar. The insulinoma secreting insulin is dropping the blood sugar, so prednisone counteracts that. So a lot of these older animals that the owner does not want to do surgery are given medical treatment in the form of prednisone to raise that. And the typical story for one of these diabetic animals is, hey, we've been treating him for insulinoma, and all of a sudden he was cured. And his blood sugar was in the normal levels, and then within a couple of weeks, it was up around 500 or 600. And we're seeing the classic glycogen accumulation and vacuolation of the islet cells. You can actually see all of the other islet cells. They're present in the pancreas as well. Okay, but this animal, and ferrets don't do extremely well on insulin. They need to get 3 or 4 insulin shots a day, and most people can't do that. But that's what happens. If you look into the history of diabetic ferrets, you will find usually that they've been treated with prednisone for some form of immune-mediated disease or insulinoma. And they just got a little too much or had it on for a little too long, and then they went diabetic. Hematopoietic system. Look at this huge spleen. It's about 3 feet long. And splenomegaly is a very, very common finding in middle-aged and older ferrets. Nobody knows exactly what causes this except for me, and I'm going to give you that information right now. Years ago, there's a lovely, very eloquent, very simple experiment that was published in rats. And they took 5 rats and they injected them in the hind leg with sterile turpentine. Why sterile turpentine, I don't know, but it gave them a good immune reaction. And within 5 days, all their spleens had tripled in size, and they were filled with immature erythrocytic, leukocytic precursors, as well as megakaryocytes. It was EMH. And this is what happens in ferrets. I know it happens in woodchucks, which is another form of rodents as well. When there is a overwhelming inflammatory response, or the body perceives a need for inflammatory cells, it will cause the production of extramedullary hematopoiesis, primarily in the spleen. And it's sort of weird because those cells never go anywhere. I've seen ferrets with huge spleens full of EMH with hematocrits of 6 and 7, and they never get any of these precursors. The spleen just gets bigger and bigger and bigger. But it is stereotypical for ferrets, and we've talked about the immune-related diseases that we have locally in the GI tract, with Helicobacter causing a profound immune-mediated disease, with coronavirus, with inflammatory bowel disease. All of these set up a cytokine milieu, which I believe turns on the spleen and causes the production of these large amounts of erythrocytic precursors. Bone marrows are usually turned on too, but not to the extent, because the spleen is sitting right there in the middle of all of these inflammatory mediators. Let's talk about lymphoma. Lymphoma is the #1 most common malignancy, #3 most common tumor overall after insulinoma and adrenal cortical tumors. It comes in 2 essential flavors. Okay, you have those that affect juvenile animals less than 2 years of age, and those that affect older animals over 5 years of age. And this is the classic presentation for a juvenile lymphoma. I don't know whether it's a T cell or a B cell, and what we used to think about that these are primarily B cells with the advent of immunohistochemistry has shown that it's not quite that simple. But the age classifications still work pretty well. And in young animals, we tend to see a triad of visceral lesions with accumulation of large numbers of neoplastic lymphocytes within the thymus, diffusely enlarging the liver and massively enlarging the spleen. The spleen has a large infarct right here, which is what happens whenever you put too many cells in the spleen. Could happen with EMH, happens with lymphoma. We'll talk about the infarcts again in a minute. Okay, obviously this young ferret didn't have much time left because of the size of this, and they just can't breathe. And they come in dyspneic. You can treat them palliatively with high doses of steroids, which tends to knock it down and give them a couple of weeks, and that's about it. But this is a typical presentation of juvenile forms of lymphoma. They're visceral. They hit a large chest mass, rising from the thymus, liver, and spleen. And this is what you see in older ferrets. They tend to have a longer course because they affect the lymph nodes. And you can live without your lymph nodes a lot longer. You can live with a large mass in your chest or without your liver. And all of the lymph nodes in this great picture by Matty Kupel are enlarged. And if we looked at all of the other peripheral lymph nodes and probably the mesenteric lymph nodes, you would see that they are all infiltrated by neoplastic lymphocytes. But this is a form, and they tend to be much more mature, whereas the ones in the juvenile forms tend to be large lymphocytes. These tend to be small, almost normal-looking lymphocytes. So these animals tend to live longer. The lifespan of these might be 1 or 2 years, whereas it may be less than a couple weeks for the juvenile forms. So that's about all the stereotyping I'm going to do with lymphoma now. I think I've learned my lesson. I still think that we need to know a lot more about immunophenotypes, B cells, T cells, etc. But do realize that if you are doing cytology on an adult animal and you see a monomorphic population of small lymphocytes, okay, don't pass it off as normal. Things I would look for is the presence or absence of peripheral blood elements. If the lymph nodes are hard as a rock, and when you aspirate them, all the cells look alike and there's no blood in the background, you're probably dealing with lymphoma in an older animal. I think that you can do a lot with cytology of lymphoma, but for my money, I still want to see a lymph node biopsy before I am ready, because this is generally a life sentence or a death sentence for a ferret. I like to see that lymph node. Call me an old anatomic pathologist, that'd be fine. Now, here's a great picture of a spleen from a ferret with lymphoma that shows a couple things. One, diffuse enlargement. They tend not to be, they could be nodular. You could see these little white nodules, but they tend to be diffuse in the ferrets and causing enlargement of the entire organ. If you took a section, you would see that there'd be marked hepatocellular atrophy and the sinusoids would be just cram-packed of cells. But there's a story that goes with this spleen. This ferret went to a practitioner, and because large spleens are so common in ferrets, the practitioner squeezed and said, well, the ferret is an 8 of 10. 10 being the largest spleen I've ever seen. It's about an 8, and we may want to think about removing the spleen. And I'm not against that, because when you have really huge spleens, as seen here, they are prone to rupture. And I wouldn't want any ferret with a big spleen due to EMH ending up with a ruptured spleen. Well, that's exactly what happened. And unbeknownst to the practitioner, this ferret had a large infarct. As we said before, anytime you put too many cells in any spleen, whether they're neoplastic cells, whether they are inflammatory cells, an animal with fungal disease or with sepsis, okay, the blood supply of the spleen is tenuous at best in the normal state, and too many cells just block it. And the spleen, it was made to infarct because of its poor blood supply. All of the vessels, especially the arteries supplying the spleen, are end arteries. The blood vessels supporting the edges are almost non-existent. So too many cells due to lymphoma in this, and we had a large infarct and probably extended down here. When the practitioner palpated this spleen, that infarct, the capsule just split. the animal got its vaccinations, it went home and went to sleep and never woke up. So be careful palpating those spleens. A disease that was initially diagnosed in skunks, particularly Aleutian mink, for many years, but within the 90s became adapted and widespread within the ferret population, is Aleutian disease of mink. And here we can see infected mink, and you can see that there are a number of problems associated with this condition. The kidneys, instead of being the normal reddish color like we see in the spleen and liver, are a golden color, which I always associate with glomerulonephritis. There are hemorrhages over the surface of the stomach, the gastric lymph node. The spleen is very large and has an infarct like we were talking about, and the bladder is dilated with blood-colored urine. And Aleutian disease is caused by a parvovirus, which now infects ferrets and has recently been reported in California in striped skunks, which are also a Mustela species. And this parvovirus really doesn't do anything. It doesn't cause any disease. But what it does is it causes the body to start making antibodies against it. But because the surface of the virus is so complex, the antibodies that are produced are not able to cross-link across the surface of the virus, which would cause macrophages to take it out of circulation. And so we continually, over the period of 6 months in the mink, but 2 years to 3 years in ferrets, which have a much more prolonged course, we get just this tremendous amount of antigen antibody complexes which aren't cleared from the system. And over time, what happens is those antigen antibody complexes, when they get to a critical level, they begin to precipitate out into the blood vessels of the body. The entire body, it's not specific, they'll go out in the lungs, but the largest blood capillary bed in your body are the glomeruli of your kidneys. So although they're precipitating out in the gut vessels and the lung vessels and whatever, the kidneys are the hardest hit. And they develop glomerulonephritis. And this characteristic golden coloration. Whenever you see gold kidneys, especially with these little red dots, think about acute glomerulonephritis. Eventually, the amount of antigen antibody complexes gets so bad that the amount of protein begins to interfere with coagulation. So we start to see hemorrhages throughout the body. We have hemorrhages not only on the surface of the bladder, but inside the bladder there's hemorrhage, which causes the urine within to become hematuria. So glomerulonephritis and bleeding are the hallmarks of the gross appearance of Aleutian disease in mink, ferrets, and now skunks. Now something has got to make all of that antibody. So if you take a biopsy of the kidney, what you're going to see, or any organ, you're going to see tremendous numbers of plasma cells where you shouldn't see plasma cells. Okay, and here the glomeruli, the vessel walls are so thick and occluded, and you can see that there's protein that is leaking out. Just a little closer, here's some of that protein in an adjacent tubule. A little more here and here. The vessel walls are extremely thick, giving you this capillary loop appearance. So that's the glomerulonephritis. Here are the portal triads in the liver. In addition to this amount of edema, you can see that almost every cell in here is a plasma cell, cranking out more antibodies in Aleutian disease. And when I say that you will find plasma cells in places you shouldn't, I always expect a little bit of plasma cell in the liver and maybe in the kidney, but you shouldn't expect them in this mixed cell infiltrate, of which a lot of plasma cells in the spinal cord. And when I start seeing plasma cells in the brain and the eyes and other than that, Aleutian disease is one of few diseases that I consider in ferrets. There was a big outbreak of Aleutian disease in the late 90s, and people were We're testing their ferrets at home. I'm not a big fan of these saliva tests. If you are concerned about elution disease in any species, the counter-immunoelectrophoresis tests are generally available through IDEX and Antec. They are blood sample tests, and I think that even above ELISA tests, they are probably the gold standard. So don't waste your money on these test at home kits. We talked about ferret coronavirus. Okay, very common today. Everybody's got ferret coronavirus, and that was, it was an enteric disease until the early 2000s. And then we started hearing reports of granulomatous disease associated with ferret coronavirus, primarily in European male ferrets. And I think that certainly it has spread around the world. And what we're looking at is the mesentery and serosa of a ferret with large amounts of granulomatous inflammation. This looks very much like feline infectious peritonitis, which is a coronavirus-driven disease of cats. And we know all cats have coronavirus, all ferrets have coronavirus, and today we are starting to see coronavirus-associated granulomatous disease in ferrets that mimic FIP. The vast majority of these cases are what we would consider the dry form, pure granulomas without the accompanying ascites. But the wet form has been identified recently in ferrets, so look for that as well. But you can see the presence of this granulomatous inflammation. This is within the liver. You can see large granulomas, and thank you, Matty Cupel, for this picture of coronavirus, ferret coronavirus specific antigen within these granulomas, showing that this is indeed the cause of this particular disease. Please don't call this ferret FIP. I hate that term. Ferrets deserve their own form of coronavirus-associated disease, even though the pathogenesis is almost identical to what we see in cats. Here's a big spleen. I believe this picture was from Dr. Robert Monaco, and ferrets occasionally do get splenic tumors. This is a hemangiosarcoma, which is uncommon and arising from blood vessels. And ferret hemangiosarcomas of the spleen are not quite as aggressive as they are in anywhere as aggressive as they are in dogs. They tend to, about 50% will remain confined to the spleen, and removal of the spleen will result in a cure. Here's another one. Not all hemangiosarcomas are going to be big and bloody. Some are extremely cellular, with all of these representing endothelial cells, which are crammed in there so tight that you can't see, you just can't see the blood. So about 50% will be a cure. Unfortunately, this particular one also had a large hemangiosarcoma of the spleen, which ruptured. You can see the intra-abdominal metastasis. So 50% may remain in the spleen, and 50% when you get in there, you will find that you have explantation throughout the abdomen. Ferrets do develop vascular tumors on the skin. Hemangiomas and hemangiosarcomas, they're all pursue a benign course. I've never seen one that metastasized or was a metastasis from an internal primary. So vascular tumors of the skin of ferrets is no big deal. Let's look at the urinary system. This is hydronephrosis resulting from an ascending urinary tract infection. And ferrets, like guinea pigs, females tend to be vastly overrepresented. They have a very short urethra, and you can have migration of bacteria up the urethra into the kidney in as little as 2 weeks. Coliforms are the most common. Proteus seems to be well adapted in the ferret, but this could be just about any type of coliform. But the vast majority of cases of hydronephrosis are due to ascending urinary tract infection and occlusion of one or both ureters by inflammatory debris. This is a picture that was published in VetPath and taken at the AFIP back in 1993 by Dr. Gary Coleman and myself. And we are looking at the urinary tract of a male ferret with the penis on the left, the urinary bladder on the right. And this polycystic structure, there's one cyst cut open here, here's another cyst, here's another cyst, here's some small cysts in the wall. And this is in the area of the prostate. And one of the problems with the sexual hormones, especially estrogen, that is released in cases of adrenal-associated endocrinopathy is that in male ferrets, estrogen will cause squamous differentiation of the prostatic glandular epithelium and the formation of these large cysts, and actually the production of keratin, which the body hates. And so these cysts often become pus-filled once the body realizes there's keratin in there. And these poor ferrets are unable to urinate. You can express their bladder, but they cannot void on their own. Oops. And this is the radiographs from one of these ferrets. You know, and actually, we didn't even know that ferrets had prostates before we started seeing this condition associated with adrenal disease. So we have these large cysts in the area of the prostate. This is what they look like when they are marsupialized, and they're absolutely full of pus. And these are the drained pus from here because they are the glandular epithelium under the effect of estrogen turns to stratified squamous and produces keratin. Body hates keratin. That's why all your keratin is on the outside, including your hair and your fingernails. So it's pus. You need to exteriorize these, drain them, put the animal on a number of medications designed to shrink the prostate, which luckily we can use the same ones that are used in humans, not only to shrink your prostate, but to grow hair. It's an odd world. Urolithiasis used to be a lot more common, and this is probably a mink. And when you're feeling poor quality food, especially high in vegetable protein, you're going to get urolithiasis. Today, if you see an animal that is blocked, and it's a male animal, chances are much higher than that it is cystic prostatic disease, as we just saw. But you can see urolithiasis, and is often a dietary issue. Here's another case in a ferret with two large struvite stones. They tend to be triangular, and they have flat surfaces where they are resting against each other as they form. Renal cysts are extremely common in ferrets. Probably 40% or more have renal cysts, and they don't really do anything. As long as they don't replace more than 60% of the kidney should function fine. We just see them all the time, and it's a nothing finding. Even if they're really big. Look at this one. Now I found that, we took this one out because it was so big. But one thing I found is that the renal capsule is made of really tough stuff. I've never really seen one rupture on its own. And this ferret was doing pretty well because it had this kidney, and the other kidney might have had a couple small cysts, but it's nothing. So it was doing just fine. But when you see something like that on ultrasound, it's just really tough to advocate leaving it in. Polycystic kidney. This is a case, and it's unusual. It's nowhere as close to what we see in many other species, including the cat. I would call this an adult dominant form because of the fact that even though the animal died early, within a couple of years, there's a tremendous amount of fibrous connective tissue separating these cysts. They probably developed over time. The adult recessive forms, usually the animals are born with big non-functional cysts. These look like they went on for quite a while before they eventually had all the filtration capacity of rocks, hence the term nephrosclerosis. But polycystic kidney disease, not a common thing in ferrets, but a nice picture. What ferrets do get, every single one, is chronic interstitial nephritis. And they're much like cats in that if they are not overtaken by other diseases, then what eventually will catch up to the ferrets around 9-10 years of age will be chronic interstitial nephritis. And you get this classic pitting of the kidney when you peel off the capsule. And this is what you see in ferrets and cats and many other species, most rodent species. And this is how time generally runs out unless you get adrenal disease, insulinoma, lymphoma, heart disease, all of the many other things that could come along and claim the ferret first. Reproductive system. I showed you a swollen vulva, and I said that that was due to adrenal disease. Well, we also see this in young, intact gills, and that is the effect of estrogen. And ferrets have problems with reproduction. They are induced ovulators, meaning that if they do not breed, they won't come out of heat. And that's a bad thing because their ovaries continue to liberate estrogen. Estrogen does much more than just cause large vulvas and hair loss. It causes a trilinear suppression of the bone marrow. So over time, these ferrets will become anemic, leukopenic, and as you can see by the hemorrhage in the diarrhea here, or melena, they will become thrombocytopenic and platelet poor. Now, because ferrets and many other mustelids are induced ovulators, they will go through repetitive cycles unless they're bred. That is why all ferrets going into the pet or laboratory trade are neutered. In addition, it helps with smell if you're going to keep them indoors, etc. But you can see on this animal, probably it has very low platelet count because you can see cutaneous hemorrhages as well as the melena. And chances are, if you are in the process of not spaying your gills, you're going to lose about 50% in the first heat, an additional 25%. And by the time that fourth heat rolls around, you'll be totally out of ferrets. Here's another one, large vulva, ecchymotic to suffusive hemorrhage within the skin, and evidence of diarrhea, probably blood tinged. Here's a ferret with that was not bred, and you can see there's absolutely no pink in the toenails. You cannot see the vein, and the pads are totally white. An excellent illustration of the severe anemia that you will see in these animals. And another animal that was not spayed and died as a result of repetitive, and this is a fibrinosuppurative pneumonia because the animal was severely leukopenic and immunosuppressed. Mastitis, it can happen. Don't know too much about, don't deal with it. This is a picture from New Zealand. Generally, they are coliform mastitis, although Staph aureus can be a significant component as well. And you've got to get the kits off of that pretty quickly because if they take in any of the bacterial infected milk, probably you'll lose them as well. This may simply slough out and heal. Obviously, this ferret wouldn't be used again for breeding purposes. And just a very early mastitis. Cardiovascular system. One of the problems that we have with the inbreeding that has gone on in the U.S. for so many years, because we started out with a couple of large producers back in the 50s, and most of our breeding stock has come from that. And although we have breeders that say, I've got 20 generations, eventually when you go back, it's all from one of the large breeders. So it's very tough to get away from that. And because we export our breeding stock, we have exported these diseases as well. And one of the things that we've seen in the American lines of ferrets is cardiomyopathy. This is an extremely large heart that takes up almost the entire chest. And as corroborative evidence of cardiomyopathy, we can see the nodularity of the liver associated with chronic passive congestion. There's really not even any room for the lungs, and you can see there is a pleural effusion. The animal probably had ascites as well. Okay, this heart should probably be about 1/3 the size of the chest, not the entire chest. Some Here's the effusion there, much easier to see. This one has a little bit more of a milky appearance, or maybe some chyle mixed in with it. If you aspirated it, it's not going to be pure fluid. You are going to see an inflammatory component, usually lymphocytes. And cardiomyopathy is a genetic problem in which over time, and it's extremely variable. I've seen animals with severe cardiomyopathy at a year of age. I've seen a lot of cardiomyopathy at 7, 8, 9 years of age, which never really killed the animal. But the key ingredient to all forms of cardiomyopathy, and ferrets get not only dilative, which is the most common, also hypertrophic and rarely restrictive. But the key to it, the base of the pathogenesis, is that over time, functional myofibers die, often in areas of inflammation, and are replaced by fibrous connective tissue. Fibrous connective tissue does not contract, nor does it conduct an electrical imbalance. So these animals are in pretty bad shape when they get to that. And if you ever wonder, am I dealing with cardiomyopathy? Because you're going to see a lot of fibrosis in there. It usually starts perivascularly and in the papillary muscles, but it's very easy to put, oh, here's a nice area of inflammation here. And if you're lucky, you'll see the inflammation. A lot of times you just get sort of this diffuse fibrosis. But if you ever wonder, just put a massage on here. And it's going to highlight here in this papillary muscle. Papillary muscles are hard-working muscles, and a lot of diseases manifest first in there. But you'll see these areas of fibrous connective tissue, which is replacing myofibers. Heartworm disease, yes, ferrets are very susceptible to heartworms, and because their hearts are much smaller than those of dogs, it only takes 3 or 4 adult worms to cause cardiac failure in ferrets. If you live in a a heartworm endemic area, I do recommend that your ferrets be put on heartworm prevention as well. One problem with heartworm disease in ferrets is they often tend to migrate aberrantly, so they can end up in the brain or in the lungs, and that's not something that you want to have to deal with. Prevention is so much easier than treating ferrets for heartworm, where the incidence of post-mortem or post-treatment death is probably about 50%, because they're great surgical patients, but they're not good heartworm treatment patients. They don't stay quiet. Respiratory system. We looked at this same picture for aspiration pneumonia, but I'm bringing it back out to say that aspiration pneumonia is one of the #1 killers of older sick ferrets. Okay, older sick ferrets are tended to with great love and care by their owners, who feed them this pureed food and give them antibiotics, and they usually they batch it up into a syringe and they syringe feed them. The problem is, if the ferret is not strong enough, it's going to inhale it. If it fights, it may inhale it. I am not a fan of syringe feeding any ferret. I'll spoon feed. I will finger feed. All you need to do is make your gruel sort of sticky and not quite as thin. And you can feed it off your finger and they will lap it up. The other thing is, a lot of times this happens to be antibiotics. Somebody sends home antibiotics in a syringe, and it doesn't matter how good the antibiotic is. If you put it right in the lung, it's going to cause aspiration pneumonia and ultimately necrosis, bacterial infections, etc. So this lesion is caused primarily by love. Very commonly seen incidental finding, often misidentified by practitioners, but it's an incidental finding in ferrets and other fur-bearing animals, including cats. And these little white spots are spots of intracellular lipid. It's actually surfactant, and the condition is known as endogenous lipid pneumonia. And you know it's endogenous lipid pneumonia and not metastatic neoplasia because you're going to cut through these, and they are just underneath the pleura. They may extend a ½ millimeter or a millimeter at most into the underlying parenchyma, and then they stop. They're a surface phenomenon. Usually it has to do with accumulation of alveolar macrophages, which are cleaning up surfactant. You can see larger areas tracking airways. If an airway is blocked and the mucociliary escalator is not carrying this stuff up, you can see endogenous lipid pneumonia. But you see it a lot, especially in older ferrets. It really doesn't mean anything. Not the best picture in the world, but I don't have a lot of these because ferrets don't die of the flu, but they sure can get it. They are the animal models. They are used in research. They can contract both influenza A and B. They can not only contract it from people, they can give it to people, although it usually goes from people to their ferrets, because the first thing you do when you get the flu, you want to go home, you want to get in bed, you want to love on your ferret, and then all of a sudden you're sneezing in its face. And it's going to get your flu. Now, it's not going to kill the ferret. It rarely kills ferrets, but it does make them sick with some of the symptoms that you'll show. And this animal is a little photophobic. It's sort of crying. It doesn't like to be looking into direct light. If you could see the nose, you would see that there is a sort of a serous discharge. It sneezes, and it doesn't really want to eat. And this is going to go on for a lot longer than it does in you. You'll be back up and on your feet. The ferret's still not doing all that well. And it can go on for 2 to 3 weeks in a ferret. Okay, but they will eventually get over it unless the owner decides to go into the medicine cabinet and give it the exact same thing that made it feel so much better, which is Alka-Seltzer Plus or something plus. And the plus is what kills a ferret, because the plus is always acetaminophen. And I've seen a number of ferrets over the years with influenza and massive hepatic necrosis. So my advice is, don't be around your ferrets when you have the flu. If your ferret has the flu, let it work its out. It's going to do fine, but don't be medicating. This could be a dog or a cat, and we see multiple granulomas throughout. Wonderful picture by John Edwards. And this is blastomycosis in a ferret. They are subject to all of the same dimorphic fungi that we can see in other species. Blastomycosis, histoplasma, cryptococcosis, coccidiomycosis. Any of those would be fine. Occasionally, we do see in the wild mustelids a related fungus, Amansia, also known as adiospiromycosis, which are extremely large yeasts with lesions only in the lungs. Usually, if we have cases of disseminated systemic mycosis, we'll see them in multiple organs in ferrets. Amansia generally hits the wild ones only in the lungs. It's an interesting but a pretty rare disease. And here we have blastomycosis with narrow base budding as seen on silver stains. Another disease that ferrets will get that has been documented extensively within the last 15 years is Mycobacterium avium. We used to lump all these into Mycobacterium avium, but now they have been broken out since we have advanced techniques like PCR. And this is actually the lungs of a ferret with Mycoplasma genevense. Systemic infection, genevense, is one of the more common, more pathogenic of the MAIC group that affects ferrets. But, a lot of these are one-offs, and it'll be Mycoplasma, something you've never heard of before. They all tend to act the same way. Looking at the musculoskeletal system. Great picture by Jeff Eggers. And this is a ferret with a big ball at the end of his tail, and it looks like he's trying to find a bass drum to bang on with it. And this is what we expect with the vast majority of chordomas in ferrets. Chordomas are the most common musculoskeletal tumor of the ferret, and they affect only the axial skeleton, which is the spinal cord to include the tail. And the vast majority of these are found at the end of the tail. They arise from little rests of primitive notochord, which are present within the intervertebral discs. Notochord is a compound that helps us as developing fetuses develop the cartilaginous and ultimately bony structure that becomes the spinal cord, or the spinal column, not the cord, but the column. And then after the spinal column and skeleton is finished with its initial formation, there's no need for notochord, and if there's any, it remains as these tiny little rests within intervertebral discs. Ferrets are well known for the development of these rests of notochord late in life into large tumors of the spinal column, going all the way up into the anterior cervical spine. Most of them are at the tip of the tail, and you can just take them off and the animal will do fine. Every once in a while they will arise in the cervical spine. I've not seen any in the thoracic spine, and I've seen a few in the lumbar spine, but if they arise in the spinal column, they look like a bag of rocks, or a bag, like the animal has swallowed a bag of gravel, because of the formation of bone within the tumor. And this is a very large tumor, and unfortunately, if they develop anywhere in the spine that cannot be removed, they will eventually result in paraparesis, pathologic fracture, and paralysis. And this is what they look like histologically. You can see this is the ventral vertebral body, the spinal cord. Here is bone marrow within the lateral vertebral body, and all of this is proliferating, infiltrating neoplasm. It's a low-grade malignancy which doesn't metastasize, but it will cut through bone like butter. And this is why, if you don't have it at the end of the tail, it is a grave prognosis. It's just going to eat through the rest of that vertebra. Traditional primary bone tumors, osteomas, are not uncommon on the flat bones, especially the cranium of ferrets, and you can remove them, and they, before they get too big, and these animals will do just fine. This is one of my favorite pictures, submitted by an owner nonetheless, who wanted to see what the bone tumor we had radiographed looked like, and did this at home and sent me the picture, and you can see this large, very dense osteoma on top of the ferret's head after they had dissected through the overlying musculature. This was the radiograph that we had been looking at for a period of several months. Not the greatest picture, but just a cautionary tale of osteomas on the face. Here's an osteoma on the face of this animal, and the practitioner was loath to cut it off for fear it might regrow, so they left it alone because they are slow-growing tumors. But if they had taken a chisel and chiseled this off, this is what the animal looked like the next year. And obviously, we have eye damage, and there is no way to remove this. And that's probably a rather painful thing. So, osteomas of the face are something that should be removed at the earliest possibility. And whereas you may have to go back and clean it up later on, generally you have a pretty good outcome. Osteosarcomas are less common. They can arise both on the flat bones and in the appendicular skeleton. Here's a large osteosarcoma submitted by Mike Garner on the hind leg of a ferret. And this is one that I had coming off of a vertebra, and I have outlined the vertebra for you in blue. This is the epaxial musculature, and look at the size. I never saw a gross picture of this animal. It must have looked like it had a large sail coming from the back of its back, because this is all tumor here, and this is the top of the spinal vertebra. Bone infections. This is a case of a Canadian ferret that had a infection of the orbit by either nocardia or actinomyces. And this is Harley, and Harley was the mascot of the Toronto Ferret Club, and he actually did quite well, lived for a number of years. Most cases of actinomyces and nocardia come in through the mouth. They are traumatically inoculated, not uncommon to find them in the mouth, and this one had worked its way up into the orbit. And every 6 months, Harley would go in and have all of this stuff cleaned out. It's really difficult to get rid of these infections. They're deep in the bone in little pockets. But he was a one-eyed ferret, went on to live for another 4 years, owned by Miss Randy Belair, and went on to live for a number of years, was greatly beloved in Canada. And this is Harley and his nocardial infection. Skin. Ferrets have a lot of external parasites if you leave them outside. Luckily, very few people do that in the U.S. One of the things that you will see, however, in most ferrets that you get at the pet store is some very dark black wax within the ears. And this is usually the byproduct of infection with the common ear mite, Otodectes cyanotus. And cleaning them out very carefully, instilling a little bit of ivermectin usually does the trick, but it's extremely common when people pick up ferrets for the first time. It's just this nasty dark wax, but easily taken care of. Ticks, occasionally seen. We don't see that much in the U.S. We just don't keep them outdoors, but if they are outdoors, you will see all types of external parasites. Okay, they do get demodectic mange, but it's not a common problem. Okay, usually an incidental finding. If they're severely immunosuppressed, you may see a clinical case, but you may find them on scrapings, and truly they're not anything to really be concerned about. My favorite picture all time from an owner shows a perfect example of the most common neoplasm in ferrets. This is a sebaceous epithelioma. If you want to call it sebaceous adenoma, that is fine. But these are tumors of primitive hair germ that arise on the haired skin of ferrets, and they are exclusively benign. They look ugly and warty, and they get ulcerated. And even histologically, when they get ulcerated, they get very ugly looking, but they are exclusively benign tumors. You just take them off. And whereas some animals will develop additional tumors like this in other spots over time, surgical excision is considered curative. The one problem with sebaceous epitheliomas that I've had over the years is they get very ugly when they get traumatized, and people tend to think they are much worse than they are. And they want to, this is a nice picture of the primitive epithelial cells and the occasional sebaceous cells that you see. But one of the issues that I've seen over time is they get very large or very ugly. They often will have a central necrotic area that people want to say that their animal has been bitten by a spider, because they can't imagine anything else that came up. And this was covered by hair, and the first time they took a good look at it, they saw that there was a hole in the middle. And I get brown recluse spider bites all the time. I don't think there are as many brown recluse spiders in the world as I've had people say that my ferret was bitten by a brown recluse spider, because they're indoor animals. Obviously, it must be a spider that got in. Here is one that was by the eye of a ferret, sebaceous epithelioma, benign tumor, and it was so close to the eye, they thought that this was the eyeball had popped out, and they were getting ready to actually enucleate this animal. So they can look very ugly, especially when they're a little bit traumatized, but they are benign, benign, benign. Mast cell tumors, number 2, in ferret skin, and they are generally little crusty raised patches. And a ferret is not a cat, nor is a dog. And a ferret mast cell tumor is benign, benign, benign. They don't metastasize. They don't go internally. They should just be taken off. They're usually solitary even once in a while. And I've only seen 1 or 2 cases where they had these multiple mast cell tumors. But you can see that they are well demarcated. They're in the very superficial dermis. They are very well differentiated mast cells, and they should just come off without a second thought. This is a biopsy from the prepuce of a ferret, and you can see these 2 little black masses, and these are apocrine cysts. And the owner's complaint, and I hear this a lot, is that someone shot my ferret in the prepuce because it has 2 little BBs in there. And they look like BBs, and through the skin they look like little blue balls. But these are apocrine cysts. And we see cysts and neoplasms of the apocrine sweat glands, which are scent glands in ferrets, most commonly in certain places, including the head, the neck, and the prepuce and around the vagina. That's where you would expect the scent glands. And so the number of tumors and the number of cysts we see are most commonly there. Cysts like this, they're benign, they're no problem. But especially around the prepuce and the scent glands and the vagina, here's a male ferret, and we have a large carcinoma which surrounds the prepuce. And especially in the areas of the genitals, the apocrine tumors tend to be malignant. They should be removed early, submitted for microscopic examination, because the incidence of malignancy in this end of the ferret is much higher than we would see in the front end of the ferret when talking about apocrine sweat gland neoplasms. And this is what it looks like on removal. Unfortunately, as is the case with so many of these animals, this was left in too long. It had metastasized to not only the sublumbar lymph nodes, but as apocrine tumors will do, it had metastasized also to the lungs prior to surgical removal. Other skin tumors of the ferret, this is a piloleiomyoma. This one just happened to be ulcerated. These are neoplasms of the smooth muscle of hair follicles, and they're primarily seen on the head and down the dorsal midline of ferrets. They are probably low-grade malignancies, but I've never seen one metastasize. This could be one of those piloleiomyomas because it's on the midline of a ferret, but this one turned out to be a vaccine-related fibrosarcoma. And we all know about fibrosarcomas related to vaccines in cats. This is from a study of 7 published out of the University of Georgia. It is not a common thing, by far less common than cats, but you can see mesenchymal malignancies arising in vaccination spots in ferrets. Most likely, what you will see subsequent to a vaccination is simply a large granuloma because the practitioner did not get the tissue deep into the subcutis. It left it in the dermis, and you will have a granuloma right there. This was a ferret in and around the face, especially around the eyelids in ferrets. There are a lot of very small nerves. So peripheral nerve sheath tumors are not uncommon around the head of ferrets. So whenever I see a mesenchymal neoplasm of the head, I initially go to peripheral nerve sheath tumor. These can be the devil to excise. This was a ferret that's actually named Bruce Bruiser after me. And you can see this was the first excision of Bruce Bruiser's tumor. It was a peripheral nerve sheath tumor, and it looks like they did a pretty good job. But the problem with these tumors are you never really do a good enough job. They tend to finger out into the surrounding tissue. And this was Bruce Bruiser about 4 months later when he was euthanized, when it was realized that you just were not going to be able to take care of this particular neoplasm. I guess a couple of other things to wind up this session. Neoplasm of the nervous system from Mike Garner, meningioma arising in the basically in the third ventricle or going down into the third ventricle. Brain tumors, in most systems, lymphoma is going to be number one. Number one in every system. It is in the nervous system. You can get all of the other tumors. And I used to say, well, I've never seen that particular tumor in a ferret. I've never seen that particular tumor in a ferret. By now, I've seen them all. I might not have seen a lot of them like this meningioma, or a lot of them like astrocytomas or oligos, but never say never when it comes to ferrets. The ones that haven't been reported have probably been seen, and eventually you'll see them. So here's a meningioma in a ferret. So we finish up nervous system, look a little bit at the eyes. A great picture taken by an owner showing cataracts, bilateral, mature cataracts in ferrets, and they are not uncommon in older ferrets. And before you go to spending a lot of money on getting the cataracts taken out of ferrets, I want you to make sure that you realize that ferrets also develop other problems associated with their eyes. Here's Johnny Angel. Johnny Angel developed glaucoma and had one of his eyes were removed because ferrets are very stoic animals. And he had a pressure of about 80 millimeters of mercury when I was consulting with the owner. And they said, what should we do? And I said, I think it's probably better if it wasn't responding to any treatment. It is probably better if we remove that eye. And so we did, and then the owner sent me this picture saying, Johnny Angel is doing great since we took his eye out. And I looked at the picture, and the first thing I saw was this blown pupil. And whereas the pressure wasn't very high, Johnny Angel was indeed blind. We made the pressure eventually got up to about 110 here. We took that out. Johnny Angel did very well as a blind ferret. And blind ferrets do extremely well because they don't rely on sight as much as they do smell and whiskers. And one of the common problems that we see in older ferrets, and please don't ask me to interpret the fundoscopic because I don't know anything about that. I know if you can't see any blood vessels at all, that's not a good thing. But we do see a fair amount. This is a normal ferret retina. Well, I don't have the other one. I'm sorry, it did not come through. You see a little sliver here where you can see that there is marked loss of the cells of the inner nuclear layer. The outer nuclear layer. That would be the inner nuclear here, and we still have some. Here the rod and cones are normal. We have very little here on the abnormal retina, and we do see central retinal degeneration as a very common finding in ferrets. And blind ferrets, especially in group situations, tend to do very well, and most ferrets become blind, and the owner has no idea that the ferret is blind, because the ferret pairs up with another ferret who it uses as a seeing eye ferret. You see them running side by side together all the time, and as long as that other ferret is there, the ferret really acts, sighted. So retinal disease is very common in ferrets, probably more than cataract disease. So it's one of those things that you don't want to spend a lot of money on cataract surgery without checking that the retina is still viable, because they do tend to go hand in hand. Finally, lymphoma in the eye, probably of the retrobulbar venous plexus or the retrobulbar fat pad, pushing the eye out, resulting in proptost glow. The eye was removed. The ferret went on to do extremely well and did not die of lymphoma. Went on to, like so many of the other ones, probably went on to die of cardiomyopathy or something else. Well, I think this concludes this 2.5-hour lecture on diseases of the ferrets. I hope that you enjoyed it, and you will look for more of these videos on the C.L. Davis Samuel Thompson Facebook page or our YouTube channel. Thank you so much for your attention, and have a wonderful day. And hit done, not delete.